Provincial modeling data shows that Scarborough will have the third highest amount of COVID-19 ICU cases by mid-April. This should be no surprise since I've been talking about in this House about how Scarborough has been disproportionately impacted by COVID-19 for over a year now. My community is home to frontline essential workers, racialized people, low-income families, people living with many health conditions, who have faced the worst of this pandemic for the last two waves, and wave 3 will be no different. My team and I are in consistent communication with Scarborough Health Network, who have been running an efficient vaccination program to do their best and protect our community. However, with the capacity to vaccinate over 35,000 a week, their resources have been massively underutilized due to this government's systemic negligence of Scarborough, its vulnerability and its needs. Last week, the Minister of Health finally answered my call for a commitment to an equitable vaccination strategy. So my question is, Mr. Speaker, has there been any work done to ensure that Scarborough receives an equitable amount of vaccines consistent with the risk that our community is facing and our vaccination capacity? Thank you, Speaker.
Well, I thank the member for the question. The short answer to your question is yes, but it depends on the supply that we receive. The doses will be distributed equitably across all of the 34 public health units, including Toronto and specifically Scarborough. We also know that there are certain hotspots in areas across Ontario. Scarborough would be one of them.
And I want to provide the minister with some statistics. For the week of March 29th to April 4th, Scarborough Health Network was given 15,210 doses. For the week of April 5th to 11th, Scarborough Health Network was given 3,510 doses, and we have over 650,000 people living in Scarborough. The amount of doses given to our health network reduced by 23%, Mr. Speaker. This is unacceptable, and it almost looked like an error to me, to be honest. I'm once again asking the minister, why is Scarborough Health Network, a body in charge of protecting and serving over 600,000 people in Scarborough, not been given an equitable amount of vaccines? Can the minister explain these numbers? Thank you, Speaker.
Minister of Health.
First, I would agree with you that Scarborough Health Network is doing an amazing job distributing vaccines. They have visited one of their centres at Centennial College. They're doing a great job, and the frontline healthcare workers, doctors, nurses, pharmacists are all on deck to deliver the vaccines. The problem is we don't have sufficient volumes of those vaccines just yet. We are receiving the Pfizer vaccines, that's true. The Moderna vaccines have been delayed several times. We're still waiting for them to be received. They were to have been received last week, now won't be received until April 7th, and even then we're not sure on that date. AstraZeneca, as I indicated earlier, we don't know when that's coming. And the J&J, we still don't have a timeline for when they'll be received. So to all of the members that are concerned about their public health units not receiving greater volumes of vaccines, it's because of the supply issue. As soon as we receive them, we will be distributing them to the public health units because we want to get needles into people's arms across the province as soon as we can.